This patient was referred to me for endodontic retreatment of tooth number 29. According to the patient, the root canal was done a few years ago. Recently, he started to have some symptoms when I saw his dentist, and his dentist told him that he had an abscess tooth and referred him to me. So upon examination, tooth, of course, was tender to percussion and palpation. Probings were 2 to 3 millimeters all around. And as you can see, this is a fiber post, previous root canal, and a large periapical lucency. So we discussed options with the patient, and patient wanted to try to save the tooth, and that's what we did for him. There was a porcelain crown on the tooth. Went through the porcelain crown, removed this long and, as you can see, very girthy fiber post. There's really was no reason for this fiber post to begin with, but this dentist had put it in, just complicating the endodontic retreatment for us. I use an ultrasonic unit, and I went right through the fiber post. You need to be really careful with when you're removing fiber posts. I mean, not removing them, but just for me, for example, going through them, because you can easily lose orientation. And if you feel that way, immediately take a PA. And here it is, mid-op, and I immediately went ahead and took a PA, and I had to course correct a little bit. I went right through it, but I was going a little bit towards the mesial, and I realized that right away, and I adjusted my orientation and was able to go through the fiber post, again using ultrasonics, and was able to redo the root canal for this patient in one appointment. And here's the post-op. So the apical diameter of this tooth was over 50. I believe it was 60 or 65. And so, as I said, when the apical diameter is large, MTA gives a much better seal. So placed an MTA plug. This is white MTA followed by gutta percha and sealer, and temporize the tooth. Now, again, because we have MTA here, if this tooth will ever need an apical is so much easier, faster now, because again, we don't have to retro prep and retrofill anymore. All right, but everything went beautifully, as you can see, and this took us, I believe, about 35 minutes from start to finish.